For many, riding a horse is a privilege reserved for special occasions, but for some adolescents with developmental setbacks, horseback riding can have substantial effects on their growth. Horses have been known to aid people of all ages and backgrounds, as Winston Churchill pointed out. There is something about the outside of a horse that is good for the inside of a man. Equines miraculously connect with and understand even the most difficult people. Autism spectrum disorders, or ASDs, are prominent in a growing number of today's adolescents. With a 90% hereditary rate, autism and related disorders are highly transferable across family trees. ASDs are diagnosed based on 3 core symptoms involving impaired social interaction and communication abilities, along with restrictive, repetitive, and stereotyped behaviors and interests. Disorders included on the spectrum are developmental and range from Asperger's syndrome, pervasive developmental disorders, and autism disorders. ASDs affect 3 core areas in adolescence: language development, social interaction, and communication skills. When testing for an ASD, physicians typically explore areas of verbal and motor skills, language skills, adaptive living skills, and aspects of self-regulation such as irritability, lethargy, hyperactivity, and behavioral actions. Treatment options vary from treating each symptom individually, such as hyperactivity with ADHD medicine, to treating each symptom as a disorder in its entirety, attending weekly physical therapy, occupational therapy, speech therapy, and animal-assisted therapy sessions. For years, physical therapy, occupational therapy, and speech therapy have been the primary treatment options for ASDs, but today an increasing number of animals are being used as treatment tools in conjunction with other therapies. Animal-assisted therapy is a therapeutic treatment involving an adolescent with a disorder that falls on the ASD spectrum, spending time and participating in activities with a certified animal in order to reduce symptoms of the ASD. One of the most common creatures used today are horses. Not being the parent's responsibility to care for day in and day out, and allowing the child and family to travel out on a consistent basis to participate in therapeutic horseback riding lessons means horses are becoming a better option for many parents with kids suffering from an ASD. Through its positive effects on physical, social, and cognitive functioning, therapeutic horseback riding is an undeniably exceptional treatment option for adolescents with autism spectrum disorders. Therapeutic horseback riding offers substantial physical improvements to participants, especially those with an autism spectrum disorder. Therapeutic horseback riding lessons involve mental, social, and physical work to be done simultaneously during a lesson. Instructors are trained to work with adolescents suffering from ASDs and use horses screened for this type of work, to blend physical, social, and mental aspects in training. During lessons, instructors give students tasks to complete, such as asking the horse to walk towards a mailbox in the corner of the arena to place the blue beanbag inside. This and similar objectives warrant praise when completed, aiding self-esteem levels, while the individual tasks assist improvements in physical and mental areas. Motor skills and the ability to listen and follow directions increase with each lesson attended. Horseback riding greatly improves balance and posture, both of which are necessary to maintain a seat on the horse. In turn, this allows the adolescent to breathe better and more clearly, allowing improvements in social functioning. Being able to breathe better helps adolescents who struggle with social aspects such as speaking and communicating as another effect of their particular ASD. Through improved posture, children's bodies open up, allowing for better use of their airways. Many kids taking therapeutic horseback riding lessons are considered to be mute when they first begin participating in therapeutic horseback lessons. In cases involving speaking improvements, the newfound communication abilities allow families to even better assist their ASD adolescent with everyday struggles and activities. While there are many healthy alternatives and additive activities to therapeutic horseback riding lessons, one parallel option is hippotherapy. Therapeutic horseback riding lessons are considered an adaptive, recreational sport, allowing participants to take part in Special Olympics events. However, it is not financially covered by primary insurance and must be paid for out of pocket. Hippotherapy is a professional treatment prescribed by a family physician, at least partially covered by insurance, and typically completed in conjunction with occupational therapy, physical therapy, and/or speech therapy sessions. The American Hippotherapy Association defines hippotherapy as a physical, occupational, or speech therapy treatment strategy that utilizes equine movement. This strategy is used as part of an integrated treatment program to achieve functional outcomes. In most cases, hippotherapy is a more formal, but also more affordable version of therapeutic horseback riding lessons that reaps equivalent outcomes. While therapeutic horseback riding has a vast number of positive effects, specifically on adolescents with the disorder falling on the autism spectrum, the activity also has its downfalls. Horses, no matter how trained or desensitized, can still respond to their fight or flight instinct should they become scared or unsure of something. In their response, they can accidentally hurt a volunteer or child. Falls and accidents are not uncommon in the equestrian world, even on the therapeutic side. Extremely loud, random noises, fast-moving objects, and other outbursts can spook even the calmest horses. But due to the amount of training, desensitizing, and the strict protocols followed for selecting these special horses, as well as instructors and volunteers, falls and accidents are kept to a minimum, with injury rarely occurring. Financially, horseback riding can be one of the most expensive sports one can participate in, including the therapeutic riding branch. If money becomes a problem for a family, hippotherapy can be recommended as an alternate form of treatment, therefore allowing insurance to assist in covering the costs without losing the benefits of therapeutic horseback riding. In conclusion, therapeutic horseback riding has numerous benefits that outweigh the risks and cons associated with riding. Despite costs and the possibility of an accident, adolescents with autism spectrum disorders benefit greatly from the physical, social, and cognitive aspects involved in partaking in therapeutic horseback riding lessons. The substantial number of parents who vouch for therapeutic horseback riding and the adolescents who are tangible success stories of the adaptive sport merely begin to scratch the surface of the positive effects therapeutic horseback riding lessons can have on a child who suffers from an autism spectrum disorder.